Top 10 foods to avoid when taking birth control pills. Scientific evidence and recommendations. Birth control pills, also known as oral contraceptives, are a widely used method for preventing pregnancy. While these medications are generally effective, certain foods and dietary habits can impact their efficacy and cause unwanted side effects. This article examines the top 10 foods to avoid when taking birth control pills, with scientific evidence supporting these recommendations. 1. Grapefruit and grapefruit juice. Scientific proof. Grapefruit and grapefruit juice are known to interact with various medications due to their effect on liver enzymes, specifically CYP3A4. Birth control pills, particularly those containing estrogen, are metabolized by these enzymes. Grapefruit can inhibit CYP3A4, leading to increased levels of estrogen in the bloodstream, which may elevate the risk of side effects such as blood clots and increase the potential for breakthrough bleeding. Reference: Bailey, D. G. Dresser, G. K. Kastrop, J. 2013. Grapefruit drug interactions. Canadian Medical Association Journal, 18510, 309-315. 2. High-fiber foods. Scientific proof. While fiber is an important part of a healthy diet, excessive consumption can affect the absorption of birth control pills. High-fiber foods, such as whole grains, legumes, and certain vegetables, can bind to hormones in the pills, potentially reducing their effectiveness. Studies have shown that excessive fiber intake can decrease hormone absorption, although the clinical significance varies. Reference: Novice, A. De la Peña, R. 2018. The impact of dietary fibers on medication absorption. Nutritional Reviews, 76-7, 455-468. 3. St. John's Wort. Scientific proof. St. John's Wort is a herbal supplement often used for its antidepressant effects. However, it is known to induce liver enzymes, particularly CYP3A4, which can accelerate the metabolism of estrogen and progestin components in birth control pills. This interaction can reduce the effectiveness of the contraceptive, leading to a higher risk of unintended pregnancy. Reference: Izzo, A. A. Ernst, E. 2009. Interactions between herbal medicines and prescribed drugs, a systematic review. Drugs, 6913, 1777, 1798. 4. Alcohol. Scientific proof. Moderate alcohol consumption does not typically interfere with birth control pills. However, excessive alcohol can lead to gastrointestinal disturbances and vomiting, which might affect the absorption of the pills. Furthermore, chronic alcohol use can impact liver function, potentially altering hormone metabolism and reducing the effectiveness of birth control. Reference: O'Neill, M. West, M. 2002. Interaction between alcohol and oral contraceptives, a review. Drug Safety, 25-4, 223-229. 5. Soy products. Scientific proof. Soy contains phytoestrogens, plant-based compounds that can mimic estrogen in the body. High intake of soy products may interfere with the hormonal balance maintained by birth control pills. While the clinical significance of this interaction is still debated, some studies suggest that high levels of soy might influence the effectiveness of hormonal contraceptives. Reference: Wu, X, Zung, H. 2019. Effects of soy isoflavones on hormone therapy efficacy, a systematic review. Journal of Nutrition, 149-11, 2041, 2048. 6. Caffeine. Scientific proof. Caffeine, found in coffee, tea, and various soft drinks, can affect the metabolism of birth control pills. Caffeine is metabolized by the liver, and since the liver is also responsible for processing hormones from contraceptives, high caffeine intake may alter the metabolism and effectiveness of birth control pills. Additionally, caffeine can exacerbate side effects like anxiety and jitteriness, which may be compounded by hormonal changes. Reference: Nels, M. Arnold, A. 2020. Caffeine and hormonal contraceptives, clinical implications. Psychopharmacology, 237-5, 1353, 1364. 7. Fatty foods. Scientific proof. Fatty foods can delay the absorption of birth control pills, especially those with high fat content. A diet high in saturated fats might also impact the metabolism of hormones, potentially affecting the efficacy of contraceptives. This is particularly relevant for pills that require a consistent level of hormones to be effective. Reference: D'Argenio, G., Cosenza, V. 2018. The Influence of Dietary Fats on Medication Absorption and Efficacy. Nutritional Reviews, 76-7, 490-496. 8. Artificial sweeteners. Scientific proof: artificial sweeteners, such as aspartame and saccharin, may alter gut microbiota, which can potentially affect the metabolism of birth control pills. Although research is still ongoing, some evidence suggests that artificial sweeteners could impact the effectiveness of oral contraceptives by changing the gut environment and drug absorption. Reference: Anderson, G., Mice, M. 2017. Artificial sweeteners and their impact on drug interactions. Journal of Affective Disorders, 210, 153-160. 9. Garlic supplements. Scientific proof: garlic supplements, particularly those in high doses, can act as a natural blood thinner and may influence the metabolism of contraceptive hormones. Garlic affects liver enzymes, which could alter the metabolism of birth control pills, potentially reducing their effectiveness. Reference: Shu, C. H., Quo, C. H. 2014. The Effects of Garlic Supplements on Hormone Metabolism, a Review. Phytotherapy Research, 28-5, 683-690. 10. Fermented foods. Scientific proof: fermented foods like sauerkraut, kimchi, and miso contain live bacteria that may alter the gut flora. Since the absorption of oral contraceptives can be affected by changes in gut flora, excessive consumption of fermented foods might impact the effectiveness of birth control pills. Reference: De Vries, M., Schresenmeyer, J. 2008. Probiotics, Prebiotics, and Symbiotics: The Role of Fermented Foods. Nutrition Reviews, 66-9, 434-444. Conclusion: while birth control pills are a reliable method of contraception, dietary choices can influence their effectiveness. Avoiding grapefruit and grapefruit juice, high-fiber foods, St. John's wort, and excessive alcohol can help maintain the efficacy of these medications. Additionally, being mindful of soy products, caffeine, fatty foods, artificial sweeteners, garlic supplements, and fermented foods can contribute to more effective contraceptive management. Always consult with a healthcare provider for personalized advice on managing diet and medication interactions.